The term that he's using here is a term called shui, which means malign blood. And this malign blood will rise up and harass the heart, leading to a myriad of symptoms, including very, very severe mental and emotional disturbances. And so this is a really important point that we need to notice. And even more so, Western medicine treats conditions regardless of the stage a woman is in her life. So if I have mood swings, or I am depressed, and we'll talk about that a bit, what exactly did that mean? And so it doesn't matter in Western eyes whether I'm depressed where I'm perimenopausal, or I'm depressed in my pregnancy, or I'm depressed after giving birth, or I am depressed right before I get my period. The treatment will be exactly the same. And here again, the beauty of Chinese medicine comes to life, because mental and emotional disorders in Chinese eyes are closely related to the 7-year cycle in women. And most of these issues actually occur in these periods of transition. It's a great, great, great formula, which actually addresses this pathological characteristic of postpartum stagnant blood that is obstructing internally. This tradition is a beautiful and simple framework that comprises yin-yang theory together with the wuxing, the 5 phases, and the liu jing, the 6 configurations. And so it's basing itself on the lingshu and the suan and the nanjing. So what are we going to be discussing today in our lecture? We'll start off with discussing a term called teenage turmoil. All these terms were coined by Dr. Ni. They're great if you think about them. Teenage turmoil is dominated by the kidneys and the heart, and it starts around menarche, which should be around age 14, and today is less and less, so it could be approximately from age 11, 12, and sometimes even earlier than that. And it lasts up till around young adulthood. And according to Dr. Ni, the main emotions that were involved or that show up that are dominant in this time are actually fear and worry, and we'll discuss them. We'll speak about premenstrual tension, and this is dominated by the liver, and this occurs psychically during our fertile years. And anger and depression are the dominant emotions that show up. We'll speak of postpartum depression that is dominated by blood. And in this case, we speak of the zangfu organs, we're speaking of the heart and the liver and the kidneys. And this occurs immediately after giving birth, and it should be around 42 days after giving birth. Of course, it can happen before. After 42 days, it can last longer than that, but also it of course shows up even while she is pregnant, and we can have the tools. We need the tools, and we have the tools to actually notice if this is going to be a problem right after giving birth. And according to Dr. Ni, again, she said that unexplained crying and depression were the main dominant emotions involved. And then we'll go into menopausal chaos, and that's dominated by the kidneys and by the spleen. And this transition occurs approximately between the ages of 45 to 55, and it's a long time. It's 10 years we can be in a perimenopausal state, and the main emotions are anxiety and fright and anger and depression. And we'll go through these 4 categories and see how Dr. Ni was actually identifying them and treating them.